proceed. So my name is Richard Brown. I work for the Chemical Safety and Health branch at the World Health Organization at our headquarters in Geneva, Switzerland. And I was asked to give a short talk about organophosphate pesticides and their effect on human health and what information that I can give on the particular pesticide, fenthion. So it will be a short overview. Fenthion is an insecticide and an herbicide in the organophosphate class of pesticides, and in common with the other organophosphate pesticides, it acts by the inhibition of the enzyme cholinesterase, and so many of the health effects of these pesticides are common, and so we can draw some conclusions about its effects based on information across the class and not just for this individual pesticide. So that's what I've been asked to do. I can give you some information which WHO has on the active ingredient, fenthion, but we do not have studies of the particular ultra low volume herbicide product which has been proposed for listing in the convention, the 640 gram per litre ULV product. We don't have information specifically on this particular product for controlling these birds, but I can give information in a more general sense, and I'll explain as I go along. So for organophosphate pesticides broadly, they act and have their toxic effect both on the targets and also on unintentional targets by inhibiting an enzyme which is essential to the way that the nervous system operates, an enzyme called cholinesterase. They all share the same effect of inhibiting this enzyme, but to differing degrees in terms of how tightly the chemical binds to the enzyme, which causes them to be either short-acting or have a prolonged effect depending on how quickly the enzyme recovery of the enzyme occurs. So different pesticides within the class will show different potencies. That also depends on how quickly they are absorbed into the body through the oral route, through the skin, through inhalation. Treatment for organophosphate pesticide poisoning is possible. There are antidotes, there are substances which can be given as antidotes, though obviously it is preferable to avoid the poisoning to occur in the first place. By monitoring the activity of the cholinesterase enzyme, you can also monitor the degree of exposure which has taken place. As with all chemicals, the severity of the health effects which are experienced will increase with the increasing dose. So the more that somebody is exposed to the particular pesticide, the more severe symptoms and health effects that they will experience. And those health effects can occur at different time points. Some will be experienced within a few minutes of being exposed, others may take a few hours to appear. In the box at the side of this slide, I've listed the organophosphate pesticides which are currently listed in the annexes of the convention, either for all of their products or for particular formulations which are have been identified as severely hazardous pesticide formulations. And many of the health effects you will see from overexposure to these pesticides are common. So the symptoms and the health effects experienced from organophosphate pesticides will depend on the extent to which the person has been exposed and how much and how quickly that material absorbs into the body, because it has to get into the body and reach the nervous system in order to have its effects. Mild symptoms, which you will see from a low-level exposure, will include things like headache, dizziness, and blurred vision, anxiety, weakness. A higher level of exposure will lead to more moderate and more severe symptoms such as pains in the muscles, abdominal cramps, diarrhea, and vomiting. Lacrimotion, which is tears from the eyes, is a particular feature to identify this poisoning. Also, constriction of the pupils. These are ways which you can identify when someone perhaps has been exposed. At a higher level exposure still, you get much more serious and potentially fatal effects. Difficulty with breathing, effects on the heart, which can be increased heart rate, it can be decreased heart rate, it can be difficulties in the heart pumping blood around the body effectively. muscle paralysis, buildup of fluid in the lungs, ultimately respiratory failure, going into a coma, and death. And fatal poisoning is not entirely uncommon with this class of pesticides. Longer term effects are also possible following an intoxication. Delayed peripheral neuropathy, which is damage to the nerves in the long term, leading to tingling sensation or loss of sensation within the muscles. Some organophosphate pesticides are associated with a syndrome which is known as intermediate syndrome, where in the days following an exposure, somebody may recover, may apparently show recovery, but after a few days suffer the muscular paralysis and respiratory failure. That can be quite a severe problem. It has also been suggested by long-term studies that long-term exposure to small but not necessarily obviously poisoning levels of organophosphate poisoning can lead to long-term damage to the nervous system. The common precautions suggested to prevent exposure are good application practice to avoid being exposed, using protective clothing such as gloves, boots, and overalls, washing and maintaining that protective clothing as well, and training of applicators in how to use the pesticide and also how to maintain their protective clothing, because that's quite important for it to continue to maintain its job. In terms of fenthion itself, WHO has a system of classification of pesticides by hazard, which is used in countries with limited resources to make an assessment of how, relatively speaking, a pesticide is based on its acute toxicity, as a simple way of regulating pesticides. It's based on poisoning information taken from laboratory animal studies, and depending on how toxic the particular pesticide is in those studies, the pesticide is classified in one of 5 categories, from extremely hazardous down to unlikely to present an acute hazard, depending on the results of those studies. This document has more than 600 pesticides listed in it. It's also available in English, French, and Spanish as a useful resource. And the information we have for fenthion from evaluations carried out by WHO or jointly with FAO on the active ingredient itself, not on this specific product, gives oral and dermal LD50 values. This is acute toxicity values, which place it in the class 2 category of moderately hazardous. So it's not as toxic as some pesticides, but it's certainly more toxic than many or the majority of pesticides. We don't have toxicity data for the product which is used for bird control, which is being discussed today, but the classification system does have a simple calculation mechanism. So if you don't have specific data on the product itself, you can make an approximate calculation of the classification. And for the 640 grams per litre product, that would similarly put you in the class 2 category. I was able to find some more specific information on fenthion, though quite old. It's based on spray products which have historically been used in agriculture and for mosquito control. We don't have an evaluation, as I said, of the particular avicide product being discussed today, but the evidence is clear that fenthion is absorbed through the skin, through inhalation, and if it's swallowed. It's one of the pesticides in the organophosphate class which has a slow recovery of the cholinesterase activity, which means repeated exposures can give a cumulative effect. And there are reports that it has been associated with the intermediate syndrome. There are descriptions, and I have no more than just descriptions, of spray workers in malaria control trials. This was a trial to propose fenthion for indoor residual spraying, and something like 27 out of 28 operators in that trial who didn't use adequate precautions against exposure suffered a number of the mild to moderate symptoms, such as headache, blurred vision, like vomiting. So there is clear evidence that this pesticide will demonstrate symptoms of poisoning if exposure is too high. There is also published data not from WHO which suggests that relative to other pesticides and organophosphate pesticides, fenthion has a relatively high case fatality, but that data is derived from self-poisoning cases, which I understand is that has particular significance or not within scope of the convention itself. But in terms of establishing the relative toxicity of fenthion, I think that's important to be aware of. That's all the information I can present on fenthion specifically, but I can leave you with a reference to a web page on our website, which is a general resource we have for information on highly hazardous pesticides if people wish to understand more information about what WHO has available on highly hazardous pesticides. I hope this short overview has been useful to you, and I hand back to the Secretariat. Thank you.